This network encompasses not just Mary Lanning. And so we have been working for the better part of a year now, securing arrangements with multiple hospital systems throughout Nebraska to be part of this, with the idea that which Mary Lanning is doing, providing greater transparency, access, information, and best-in-class pricing, so too they would as well. There was another piece to this puzzle that we had to bring in, and that was Consociate Health. So they will actually serve as the claims administrator for this program. They are independent, and their responsibility is not to Mary Lanning, nor is it to Ellerbrock-Norris, but it's to you. It's to you, the employer. So that's who they will ultimately work for within this network capacity. What they have done in other parts of the country has been phenomenal, reducing costs significantly over time, reducing medical trend over time, increasing value to employees. All of these things we believe can be achievable, and these aren't achievable things that are 2, 3, 4 years down the road either. We believe that there is significant impact that can be made in 2021 with this program. As a matter of fact, we've recently done a number of analyses on some self-funded plans here in Hastings, where we have been able to identify, in many cases, hundreds of thousands of dollars that can be recouped if those claims were to happen again. And that's not just because of the contract language for Mary Lanning, but also through transparency and understanding how to get ahead of claims, but also the referral partner contracts. We will customize the network program to your organization. Now, there's two types of organizations here. There's those that have fewer than 50 enrolled employees and those that have more than 50 enrolled employees. And the reason I draw that distinction is because the underwriting structures will be different for both. If you're over 50 employees, then you are what's called experience rated. In other words, your rates are a derivative of your experience, your performance, your claims. And so whether you get claims data or not, we can pretty close determine where your claims fall based on your insurance networks, your plan designs, and your current premiums. If you're below 50 employees, that's a little tougher because your rates are not just based on your performance, but based on the entire state of Nebraska's community rated performance. And so there's some few extra steps that we will have and some more, we'll call it boilerplate programs that we have for under 50 enrolled employees. But if you have more than 50 employees, we can easily determine opportunity for you. And if you're a self-funded employer, at least one that gets data, I argue that all employers over 50 lives are self-funded. You're paying your claims whether you realize it or not. But even those folks that are self-funded, we can certainly do greater analysis of opportunity for you. Another key component, and this is outside of Mary Lanning, is what we're doing around prescription drugs. And again, for every 100 employees, there's approximately $100,000 of waste in the prescription drug world. And we're finding that money each and every day. And so there's certainly opportunity to be had there. The idea behind the network, because we're streamlining it, because we're creating better access at better pricing, is that we want to create programs that improve deductibles, co-insurances, and co-pays for your employees. And so each of these plans will have tiered networks. And by tiered, I mean there will be a preferred network, which is obviously Mary Lanning, a second tier network, which is our referral partners, and then a third tier, which is a national network that will serve to wrap all outside, we'll call it conditions. And so within the Mary Lanning network, we'll create incentives for tier 1, which is to Mary Lanning facilities, that lower your employees' deductibles, in some cases from a benchmark perspective. And we worked with Consociate Health, who again has done this in multiple areas throughout the country. And they'll be part of this conversation with you, that would reduce the employees' deductibles by half, the co-insurance by half, and the out-of-pocket by half. That is a financial win for you and a financial win for the employee. So the idea here is that we want these plans to only get better for your employees, and that there's certainly an avenue to do that while simultaneously managing your cost in a more effective and efficient way.
And I think you said it best there. The goal of the network was to only improve on plan design, flexibility, deductible structures. And I think it's just important in this piece to talk through that. The intention of that is so that your employees are going to get the care they need at the time they need it. And that is not that a deductible or a copay or anything like that is not the barrier to your employee getting that care.